In quantitative health research, studies can be broadly categorized into 6 main types: case studies or series, descriptive studies, surveys, case control studies, cohort studies, and intervention trials. Each of these study designs answers slightly different questions with varying degrees of certainty. Case studies or series are descriptions of one or more cases. They offer an initial insight into what may be related to a health problem and are often reserved to either highlight unique or rare cases or generate hypotheses. Descriptive studies look at patterns in disease populations and variations by time, place, and person, often using routine data sources. Surveys, also known as cross-sectional studies, offer a snapshot in time and ask questions of prevalence and association between health status and various factors. Generally speaking, descriptive studies and surveys address questions surrounding who and what are associated. For example, who is most likely to develop heart disease, or what do people who are diagnosed with multiple sclerosis have in common? These questions look at population health as it is without trying to change it, relying on existing data sources such as census or larger-scale surveys to collect information. Case control studies determine whether exposure to a factor of interest differs between cases, those with a target disorder or disease, and controls, those without the target disorder or disease. These studies tend to be retrospective in nature as researchers look back at existing data and separate people into groups. Cohort studies determine how much change occurs over time between those exposed, not exposed, or exposed less to a factor of interest at the time of study inception. These studies are prospective in nature, meaning data is collected by first surveying and then following up with participants over time. Cohort studies allow us to ask questions that are temporal in nature. Did the exposure precede the disease or have any effect over time? Intervention studies look at determining the effect of interventions on patient-important outcomes by taking a sample and intervening in some way with some participants and not others. We can then compare intervention and control groups and answer questions regarding how much change in health or incidence of disease has been mitigated by the intervention. Intervention studies tend to be the most rigorous research design, as we are able to precisely control who does and does not have exposure to the factor we are interested in testing. They address questions surrounding what treatment is better and by precisely how much. Qualitative research is used for investigating and understanding the social world rather than predicting, controlling, and explaining behavior. It is used to describe, understand, or interpret daily life experiences and structures from the perspective of the population under study, to understand their meaning and understand the process by which events and actions take place. It often focuses heavily on the context of the participants and the study, and the meanings this context produces. Qualitative research is also used to study the stories or narratives of individuals and how they make sense of their own experiences. Where quantitative research may start with hypotheses and rigid guidelines for the study design, qualitative research is a reflexive process that starts with a research question and/or a number of questions and sub-questions. These questions are often very wide-ranging on a studied topic, with a goal of narrowing down the information as the study progresses. The initial question may even change or evolve over the course of a study, depending on the information gathered with participants. Compared to the hypothesis testing of quantitative research, qualitative research actually tends to be hypothesis generating, usually during the research rather than before. This is because the focus of qualitative research is to deepen understanding and discovery, with the end goal of exploration and description, rather than controlling or predicting. The goal is to achieve thick descriptions rather than empiricism. Qualitative research methodologies can even lead to the generation of theories about the explored topic. Qualitative researchers are primarily concerned with process rather than outcomes. They ask process-oriented questions about how things occur or what a particular experience is like. For example, how do people reconstruct identity following the loss of a driver's license? Or what is it like to experience a driving assessment? Qualitative research techniques can be used to study many types of research questions. Methodologies guide research designs and target specific research questions. A typical grounded theory question will ask about social processes, such as what influences the process people go through when deciding to report an injury event at work. If you wanted to understand the meaning of an experience to someone, you could use phenomenology and ask questions such as, what is the experience of elderly people losing their driver's license? If you wanted to study a collective or culture or setting, you could employ an ethnographic methodology and ask questions such as, how does a specific culture or group of people experience family loss? Each of these methodologies are designed to better reach one aspect of a given topic, whether it be the experience or phenomenon itself you would like to study, the meaning participants give to the experience, the process by which they go about dealing with that experience, or how participants have stored their experience and how that has impacted their lives. There are generic qualitative research studies being done that ask less specific questions, do not use a given methodology, but still use some qualitative methods and techniques. These types of studies run the risk of method slurring, leading to inconsistency and lack of coherence throughout the research. For this reason, it is important to choose a good research question and then see which methodology can best answer it.